The next one to present in the oral presentation is Nyasha Sibanda. Nyasha, are you there? Could you please unmute? And you've been given permission to present, so please share your screen.
Hi, everyone.
Hi, Nyasha.
I'm here.
All right.
It's good to meet you. Let me just start screen sharing just now.
All right.
So, my name is Nyasha Sibanda. I am currently based in Zimbabwe. I'm a final year clinical biochemistry and toxicology student at the University of Zimbabwe. I'm also passionate about public health, especially sexual and reproductive health rights. And I'm also very passionate about community. So I work hand in hand with rural communities to translate complex health information into simple ways that they can understand. So my research was more of um, the work that a project that I actually did. It was on climate change. So climate change, I believe it's no longer just an environment issue, but it's actually a public health issue that is affecting everyone worldwide. In Zimbabwe, unsafe water, extreme weather, and rising disease patterns. So, my project is on a community driven approach to linking climate change and public health in Zimbabwe. Okay. I was saying climate change is no longer just an environmental issue, but it's a public health crisis affecting everyone worldwide. So in Zimbabwe, we are already experiencing this, especially through unsafe water, extreme weather conditions, and rising disease patterns. So let's go to the problem statement now. So here is the gap. Most of our communities often experience the impact first, and usually it's deadly, but they have the least access to data and tools to respond early. So there is usually limited local data. There is slow response to risks. There is low community empowerment. Most of our community members are not educated. They do not know what to do when crises like these hit. Let's go to slide 4. Okay, so what did we do? So I'm the founder of a community healthcare initiative. It like I've said, we help people mostly in rural areas to translate complex health information into easy things that are easy to understand. So that's where this eco health tracker comes in, which with the help of the University of Zimbabwe Innovation Hub, I came up with. It's a low cost community driven tool that connects environmental changes directly to health outcomes. So how does it work? That's slide 5. So we use it to track indicators like water quality, weather events, and waste management. And then we link them to diseases that are common like diarrhea, vector-borne infections, and malnutrition. These are the most common diseases that affect people in rural areas. So, how is it scientifically credible? That's the next slide. So, this research is grounded in clinical biochemistry and toxicology. So, we try to ensure that the indicators are not just accessible, right? But they are also scientifically relatable and easier to use for the people in our communities. So, what's the impact of this eco health tracker? So, the real power of this innovation is in the impact that it has on the people in our community. So, we are saying there is early disease detection. This helps in better decision making and stronger community resilience. And then it also shifts our communities from just reacting to the triggers to preventing whatever will be happening. So, most importantly, I believe that this is not just for communities. It is with communities. We are working with communities. We don't want people just to be we don't want people just to be beneficiaries, but we want communities to participate. So we use workshops, we run community workshops in in their community halls, and we also use IEC materials that make it easy for them to try to get the message, and it makes them eager to participate in our programs. So through these grassroots participations, the workshops, and local engagement, these people become co-creators of solutions as well. So, what is the belief in business? I believe that community-driven impact and focused innovation can outperform profit-driven models because it was not about profit; it was about helping the community sustainably. So I believe this because sustainability starts with ownership and not just being beneficiaries, but active participants in the work. So, in conclusion, I think the future of public health is not just in laboratories and policies. It is also through empowered communities. So our eco health tracker is one step towards that future, and I'm so proud because mostly women are the ones who are leading in the work, in the research, in the collection of data, and also in the monitoring and evaluation. So we are proud to be empowering our communities to bridge climate and health. Thank you so much.
Thank you to Nyasha. Thank you very much. You have stayed within your time and we are grateful. Can we please give her a hand? All right, so this is work going on in Harare, and we want to hear from our panel of doctors and PhD holders, starting with Dr. Vida Akaitete. Please, what feedback would you like to give to Nyasha?
Thank you. Nyasha, this is a very good presentation. And it boils down to women coming up. Because when it has to do with climate change, it has to do a lot with women. Very important. When it talks of quality of water, when it talks of waste management, where I did my PhD, the art area, I see waste like gold, and I see how we can manage gold for our benefit as members of a community. And when you talk of waste, women spearhead waste issues. Very well presentation. I like the your Zido, your slides could not come out. Everything you said was well understood. And I also applaud you for the introduction of the tracker to monitor those environmental indicators.
Okay.
I say bravo, and I will see how this tracker will change whatever is going on in the area so that lives will be saved and women will be happy. Very well presentation. Well done.
Thank you, Dr. Akaitete. Dr. Jembibi.
Hey, That's a very good presentation. Um, it shows that she was really involved in the project, or she's still involved in the project.
Yeah.
It's more or less like she's having a discussion about the project, which is very good. She's on top of issues. I would like to know from her, is the project still ongoing or they've wrapped up? Then I will come in with a brief observation and then some submissions.
All right.
All right. Thank you, Doc. The project is still ongoing because we started last year in 2025. So I want to see how much impact it's going to have. So I would need to make sure that it goes on for maybe 3 to 5 years until we are sure of how much impact it has on the people. At the same time, we are trying to upscale it, come up with more innovations to improve, and come out with also other complementary projects that can help people in the community.
Okay. Your narrative is very clear and very compelling. Um, my personal opinion, this presentation looks more like a project concept note than an abstract.
Okay.
Because I can't see any concrete methods in your presentation. Maybe you did some baseline study, because you're talking about trying to look at the impact. So I was expecting some baseline study, then based on that, when you are done with the project, you'll be able to tell how much impact your project has brought to the community. The originality and relevance is also very high, especially in you trying to bring climate health linkages.
Yeah, I
And
agree.
community ownership.
Mm-hmm.
But your empirical evidence is underspecified. You haven't given us any data so far.
Yeah.
Any data you have collected, how the data looks like, at least to brief us a little, because I still see it as more or less a concept that's to be very honest with you. Maybe unless I get a full detailed report, then I'll be able to appreciate it. So you also didn't talk about the sample size, how you are collecting your data, which analytical approach you're using. In order to sound more research driven, I didn't see that. I think I'll pause for now.
All right, let's move to Dr. Abo.
Thank you very much. I'd like to say that Nyasha gave us a very good presentation. I really like her PowerPoints. They were really PowerPoints. They were not essays. And she was able to talk to the points. That's what I like about it. And then the fact that it is an innovation and with women, so that the women can own the project by themselves. But I agree with the two previous speakers, especially JMBP, that we don't have any data. Like the previous person said, we don't have any location and all that. But I think that, as she said, she's going to work on it. But I just want to say that each time you are giving a presentation, whether the project has ended or not, there are certain points that have to come out, like your purpose for the project, your methodology, the sample size, the methods you are using and all that. It has to come out clearly so that people can actually appreciate whatever results you are bringing. Otherwise, it's a good start. Thank you.
Thank you too, Dr. Abu. So Nyasha, I can see this getting to the point of becoming a social enterprise. Doing a baseline study would help you get the data you need to get funding. So do work on that. Is that all right?
I would definitely do that. Thank you
Okay.
so much for the
Thank you
opportunity
too.
to present my innovation.
All right. Thank you so much. Shall we please give Nyasha a hand?